Hello everyone, welcome to my YouTube channel Logic Medico. Today's interesting topic is difference between emmetropia, myopia and hypermetropia. So what are these words? We'll see that. What are these conditions in the eye? So vision, the normal vision, if a person has got, it's called as emmetropia. If the person has got defective vision, it's a refractive error, they're called as myopia and hypermetropia. So let's see these things in detail. If you are new to my channel, kindly subscribe to my channel and press the bell button. Okay. Rays of light from a long distance are coming parallel to one another like this. Subsequently, they have to pass through the cornea, the aqueous humor, through an aperture in the iris called as pupil, the lens, the vitreous humor. We have a biconvex lens within our eyeball. Ultimately, these rays of light will have to refract through this. So the refractive index of all this becomes important. The image of this object will now fall on the retina. It will be of same size, real, but an inverted image. This inverted image now passes through visual pathway, that is optic nerve, optic chiasma, tract, lateral geniculate body of thalamus, and falls on the occipital lobe of the brain. There it will get inverted. So two times if you invert the image, you will actually see a vertical image like this. Okay. But what happens when the rays of light are coming from a shorter distance? They will be having a diverging rays. Then it has to pass through all similar structures including the lens. Ultimately the image is formed on the retina. So what is this emmetropia? Emmetropia is called as a person who has got normal vision with no visual defects is referred to as emmetropia. Images are formed on the retina in emmetropia. They are focused, clear and precise image. The eyes that have emmetropia does not require any vision correction. So emmetropia is normal vision. Okay. When a person has got emmetropia in both the eyes, the person is described to have an ideal vision or a normal vision. So they don't require any glasses or contact lenses. So emmetropia is a normal vision. The image is formed on the retina. It's focused, clear and precise. They don't require any visual correction. So coming to the myopia. Why myopia happens? What is the pathology behind the myopia? Here you can see the eyeball, it's bigger, right? So the basic pathology in myopia is eyeball is larger in size. So the rays of light coming from distance will now get converged by our lens and the image will form in front of retina. So when it falls in front of retina, it will not be that clear. No? It has to fall on the retina. So if one of the eye has got like this, it's called as myopia, where the eyeball size is enlarged. That is a basic pathology involved in myopia. It is also called as short-sightedness. But why? See, rays of light coming from a closer distance will fall on the retina. So the person will be able to see short sight, that is closer vision, very clearly. But the same rays of light coming from a longer distance will now fall in front of retina. So they will not be able to see clearly the objects of a longer distance. So if they want to drive the car, they have to wear glasses. So just now I told you why it's called short-sightedness. Those diverging rays coming from an object of a shorter distance will fall on the retina, so they can clearly see the book or a television or something from a shorter sight or shorter distance. Therefore it is called as short-sightedness. Okay. So that is why myopia is called as short-sightedness, because the object from a short sight will fall on the retina. The rays of light from a short distance will diverge and ultimately converge by our lens. so it will fall on the retina. When it falls on the retina, the person is able to see the image clearly, so they can see very well from the objects of a shorter distance. Coming to the hypermetropia. So why the hypermetropia happens? What is the basic pathology in the eyeball? Here you can see the eyeball size is slightly smaller than normal. So what happens? The rays of light are going to converge behind the eyeball. It's not converging on the eyeball, it is behind the eyeball. So they are called long-sightedness. Why do you think they are called long-sightedness? Because from longer distance the rays of light will be still converged onto the retina, so the person is able to see longer distance object very clearly because the image falls on the retina. But same thing won't happen with a short distance, because the eyeball is shrunken. The rays of light coming from a short distance will fall behind the retina. So why hypermetropia is called long-sightedness? Because the rays of light coming from parallelly from a longer distance will converge by our lens onto the retina, so they can see the object clearly from a long distance very clearly. So they don't require any glasses while seeing anything from a longer distance, but they require the glasses for seeing closer distance. Coming to the treatment aspect of these two things, to understand that, first we have to know what is the difference between biconvex lens and biconcave lens. Biconvex lens is a converging lens where it will increase the refractive index of our eye and it will converge the rays of light more powerfully. Okay, biconcave lens on the other hand is called diverging lens because it will diverge the rays of light like that. Ultimately the image is formed like that because we have a biconvex lens within our eyeball itself. Okay, otherwise all the rays are diverged means nobody can see. Biconvex lens increases the refractive index of the eye because it is a converging lens. Biconcave lens decreases the refractive index of the eye because it is a diverging lens. So the treatment of these myopia and hypermetropia is actually lens. But which lens should be given for myopia? Is it biconcave or biconvex? Which lens has to be given for hypermetropia? Let's see this. Treatment for myopia is definitely lens. But which lens? Is it biconvex lens or biconcave lens? Is it converging lens or diverging lens? So what is the treatment? Can you think? It's definitely lens, but which one? So what is the basic pathology in myopia? The eyeball is enlarged. So you will give biconvex further to increase the refractive power or biconcave? Answer is biconcave. Why? The eyeball is enlarged. If you give biconcave, it will diverge the rays of light, and then again we have a lens within our eyeball which will converge rays of light onto the retina. So the person is able to see not only short distance but also long distance clearly. So therefore we have to prescribe biconcave lens for a person who has got myopia. So because biconcave lens will diverge the rays of light initially. So when it enters the eyeball, we already have a biconvex lens. It will converge the rays of light onto the retina. That is the logic behind prescribing biconcave lens for a myopic patient. They have to wear these glasses whenever they are driving or want to see a long distance clearly. Maybe a sunset or a sunrise also they want to see, they can wear the glasses. Coming to the treatment of hypermetropia, of course it is lens again, but which lens? Biconvex lens or biconcave lens? The basic pathology in hypermetropia is the eyeball is shrunken in size. So if you give biconcave, it will further diverge the rays of light and the image will form further behind the eyeball. So we have to give biconvex lens. When you give biconvex lens, what happens? The eyeball is already shrunken, so converging lens, so it will converge the rays of light further. We have one more biconvex lens inside our eyeball that will also converge.
So both the refractive indexes will add up and ultimately the image is formed on the retina. So therefore in hypermetropia we have to give biconvex lens. But how do you know that it's biconvex lens? If you just touch the surface, if it is bulging on either side, okay, it is biconvex lens. Okay, so if you touch like this and like that, it's bulging, right? So it's biconvex lens. Whereas in myopia, if you touch on either side, it will be depressed or it will be a shallow groove like thing. That is biconcave lens. So that's how you know in simplest way the lens given for that particular person is biconvex or biconcave. Okay. So in hypermetropia, we have to prescribe biconvex lens so that the image falls on the retina. Now the person is able to wear the glasses whenever they want to read a book or sow the seeds, grains, whenever they want to see television, anything which is concerned with the near distance, they have to wear those glasses. In summary, the emmetropia is normal vision, normal sight. Myopia is short sightedness. Hypermetropia is long sightedness. The basic pathology in myopia is the eyeball is increased in size, so the image falls in front of the retina over there. The basic pathology in hypermetropia is the eyeball is shrunken in size, so the image falls behind the retina. Myopia is called short-sightedness because they can see objects from shorter distance clearly. Hypermetropia is called long-sightedness because they can see the objects from a longer sight more clearly. So emmetropia is normal vision, normal sight, the eyeball size is normal, rays of light coming from either short distance or long distance will be converged onto the retina, that is emmetropia. In myopia, the eyeball size is enlarged and the image is fallen in front of the retina, where in hypermetropia, the eyeball is shrunken and the image falls behind the retina. So that is the basic funda between the emmetropia, myopia and hypermetropia. So here the refractive index in emmetropia of all the things, that is a cornea, aqueous humor, lens, vitreous humor, is normal. If any one of the refractive index is gone, in myopia, basically the eyeball is enlarged in size. So what happens? The image falls in front of the retina. Whereas in hypermetropia, the rays of light will converge. It will not fall like that image on the retina. It will fall behind the retina. Basically, the refractive index may remain normal because the eyeball has shrunken. The image may fall behind the retina. Because the eyeball has enlarged, the rays of light, though it's converging normally, it will fall in front of the retina because the eyeball is enlarged now. So that is the logic. Basic pathology is there in the eyeball size. Okay. It can also be there in the refractive index. Coming to the treatment aspect, biconvex lens is a converging lens, biconcave lens is a diverging lens. The treatment for myopia is we give biconcave lens. If you touch on either side, it will be grooved or shallow depression will be there. It will diverge the rays of light. So if you give biconvex lens, it will further converge, the image will fall over there. Okay, it will further fall in front of the retina. So therefore we have to give diverging lens, biconcave lens, so that initially rays of light are diverted. Subsequently by the lens within our eyeball, it will get converged onto the enlarged eyeball, onto the retina. Though the eyeball is enlarged like that, the image is falling on the retina now. Okay, so biconcave lens is given for myopia, so that it diverges the rays of light and ultimately the lens within our eyeball converges the image onto the retina. That is the logic behind biconcave lens. Whereas in hypermetropia, the eyeball size is reduced now, but the image is falling behind the retina. So you have to give that lens which will further converge the rays of light, which is the lens biconvex lens. It's a converging lens. So when you give that, rays of light will converge first. Second, we already have one more lens within our eyeball, that is also biconvex, that will also converge. So both the refractive index add up. The image which was falling behind the retina now falls on the retina. So that is the treatment aspect of hypermetropia, that is prescribing biconvex lens. So this person can see not only long sight now, by wearing these glasses they can see even objects from short sight clearly. So in myopia, short sightedness is already there. but by wearing a biconcave lens they can see longer distance also clearly. So that is the logic behind prescribing biconcave lens for myopia and biconvex lens for hypermetropia. So what is the refractive index? We'll see that rays of light coming from a distance will be focused by the cornea, aqueous humor, lens, pupil aperture, it's just an aperture, lens, vitreous humor onto the retina. The refractive index of all this will add up with one another, ultimately causing the image to fall on the retina. The image formed is real, small, same size and inverted. The refractive index of cornea, aqueous humor, lens and vitreous humor determines the image falling on the retina. Even if there is a damage to the cornea or some problem in the aqueous humor or vitreous humor, vitreous hemorrhage, lens, cataract or some other abnormality, even if it alters, the image can fall behind the retina or in front of the retina. It is not only the size of the eyeball, even the damage of these structures can alter the refractive index. If it decreases the refractive index, then the image falls behind the retina. If the conditions increases the refractive index, then the image will fall in front of the retina. If the image falls in front of the retina, it is myopia. If the image falls behind the retina, it is called hypermetropia. So the basic pathology in myopia is enlarged eyeball. In hypermetropia is shrunken eyeball. But in addition to this, the damage to these structures can also result in image falling in front and behind retina. I hope you understood this. Kindly like and share this video. Don't forget to press the thumbs up button. If you like this video, subscribe to the channel and press the bell button to get the latest notification of the video. Thank you once again for watching this video. Don't forget